Okay.
So I will go ahead and start. Hi, everybody. Welcome. This is our second webinar in the Community Health Strategist series. And just want to say thanks for joining. I'm going to just introduce Barb, and then she's going to take it from here. But I wanted to say a couple things before I launch into that. I have everyone muted, and when we're done, I will unmute everyone, and then we can have a conversation. But I would like to ask that you listen to Barb's presentation, think about any questions you have, and if you have questions that seem like they're important to clarify as she's presenting the material, send me a quick, you can roll your cursor around and you can find a button that says chat. You can either send a message to me or to everyone on the call. And we'll pause. If I get a message from somebody with a question while Barb is presenting, I'll ask her to stop and answer it right then. Otherwise, we'll save up some questions and we'll have a conversation at the end, and I'll unmute everyone like I did the last time. So I really appreciate you all joining, and Barb is a vice president at Riverstone Health, as you all know. She's the vice president of communications and public relations. She has a ton of government relations experience and a ton of experience working with policy issues at the local level as well as the state and national levels. And I think we're just really very lucky to have someone with her expertise here in Montana. So I will turn it over to Barb with that. And Barb, please add anything about your background if you would.
Great, Jane, thanks so much for that nice introduction. And when Jane says I have a ton of experience, I suppose I do. And I know that I was on a panel a couple of months ago, and it was one of those things where I didn't want to disclose how long I've been doing this, but it's been quite some time. So really a little bit more about my background. I've been kind of working in and around the legislature since I was in college in the late 80s. So I've seen a thing or two, and it's always an interesting opportunity to take a look at sausage making in action. But today I'm going to talk to you more about the legislative automated workflow system, or the LAWS system, and give you kind of some tips and tricks and help you get familiar with how that works, so that hopefully if you have interest, you can follow along the legislative process as well. So I just want to begin this presentation by this quote from the Institute of Medicine, which I think they've actually changed their names, but they say it is unreasonable to expect that people will change their behavior easily when so many forces in the social, cultural, and physical environment conspire against such change. You know, we all at a local public health level, and even at a medical level, we've all been told we need to exercise more, we need to eat better, but there are so many things in our environment that make it hard for us to do that. And one of the ways in which we can actually help people and set them up for success is through public policy work. And I'm sure that all of you have seen this slide before. This is the former CDC director, Tom Frieden, put this slide together to really try to visually depict how you can improve health through different interventions. And you'll see at the very bottom of that pyramid, changing the context, making the default option the healthful option, or as we like to say at Riverstone Health, making the healthy choice the easy choice. I think it's really interesting on the left-hand side of the slide. You'll see the arrow that goes up and down, and at the top it says low impact, high resource. So when we're talking about behavioral interventions in terms of counseling or education, and if you would just exercise more, a lot of times that just doesn't motivate people to do the right thing. And we can, I guess, talk a lot about getting people to try to change their behaviors, but in the green type, high impact, low resource, I sort of take exception with that. I really think that changing the context, through policy change does make a huge impact. I do take exception with the low resource. However, policy change is really hard sometimes, and it can take many tries to get it right. So just some definitions about policy and politics, because really what we're talking about when we talk about the Montana legislature or public policy, or even family policy, if you will, there's always politics that come into play. So, just really from a high level, policy, and not necessarily public policy, is a rule made and enforced by people in authority to control the behaviors of other people. So like, think of family policy, think about, if you have children, you and your spouse are setting the policy for your children and your families. You think about your workplaces, and you think about the policies that are within your workplaces and how and why those policies get made. And that's where the politics comes over. So we've all kind of been in those situations where we think that something should be done, but the people in authority who are setting the policy, they decide who gets what, when, and where. And hopefully it's without resorting to physical violence. That's how wars get started. And I know many of you had the opportunity to be on the first webinar with Jack Thompson, and he talked about policy from a different standpoint in terms of public policy, in terms of what governments choose to do and what they choose not to do. And if you think about that in the context of public policy at a local level, within your city council or your county commission, at the state level within the legislative process, at a federal level in Congress, inaction as much as action really does tell. It's very telling in terms of what policies are being promoted or not being promoted. So I just wanted to clear that up to make sure that you understood that this slide here, policy is a very broad definition and not necessarily the public policy definition that Jack used at your last webinar. But today we're really going to be talking about the Montana legislature, the automated workflow system, and the legislative public policy making. So moving into that, the Montana legislature, the 66th session of the Montana legislature, to be specific, kicked off yesterday with the swearing in of 150 members. They'll have a 90-day session. It happens every other year, which is the odd year. I think there's only 4 other states in the country that have an every other year session. So definitely Montana is the exception rather than the rule. Many other states, they have full-time legislators and professional legislators, meaning that's their job, and they get paid for that, and they have legislative staff members. So, but specifically for Montana, House of Representatives members are elected to 2-year terms. So every 2 years, the 100 members have to, if they're interested, refile for office, and the filing fee is only $15. So if any of you happen to be interested in running for the legislature, cost as far as the filing fee should not be a barrier. And so the $15 filing fee is the same for the House of Representatives or the 50 members of the Senate. And the 50 members of the Senate are elected to 4-year terms. So they don't turn over every 2 years, but they turn over every 4 years. So you're able to develop some kind of consistency within the Senate. Currently, the Senate is controlled by the Republican Party. There are 30 senators that are Republicans and 20 senators that are Democrats. In the House, the party in control, again, is the Republican Party. There are 58 members of the Republican Party in the House and 42 Democratic members in the House. So really what that means is that the House and the Senate, the legislative chambers, are controlled by the Republicans. The governor's office is controlled by the Democrat Governor Steve Bullock. So you have inherently a little bit of a tug there. And that's, I think, actually a nice way to put some checks and balances on things. These individuals go to Helena every other year, like I said, for 90 days to make laws. They look at things that could be or perhaps should be changed in how the state operates. But during the time that they are not in Helena for that 90-day period, there's about 18 months when they're in interim. And during the interim, there are interim committees. And those committees are made up of equal number of Democrats and Republicans, equal number of House members and Senate members. And so oftentimes what will happen is during the interim, these different interim committees will have an opportunity to study issues more in depth. Because I think we can all realize that 90 days for a citizen legislature to make decisions about issues that they may not have personal experience with is really a short time. And again, our legislature, they are citizens. Many of them are retired. Some are teachers, some are ranchers, some are business people as well. But by and large, they do not have experience with public health issues or medical issues. So asking individuals to make decisions based upon, their own personal knowledge of those issues sometimes can be tricky, but these interim committees, depending upon what issue they're studying, they have that 18-month period to really dig into an issue very deeply, get to know more about it, perhaps develop a passion for it, and be able to propose legislative changes if they're necessary to the next legislature. And I will say that typically bills that are generated through the interim committees typically do have a much easier time through the legislative process. And, sometimes that's a good thing, sometimes it's not a good thing. Impacting Montana legislative public policy making is term limits. So one of the interesting things about Montana, and the voters went to the polls several years ago and decided that they didn't want legislators to remain in office for a really, really long time. So right now, the legislature, House members are relegated to a total of 8 years, and the Senate members are also relegated to a total of 8 years. So the House members can serve 4 two-year terms, and the Senate members can serve 2 4-year terms. But that doesn't mean that they can't switch chambers, and they often do. This legislative session, we have 3 members who served in the Senate for 8 years, transferring over to the House now. And actually, I think there's 4 members doing that. So I think that in a way that's good, because there is an opportunity to continue to develop some expertise in issues, understand more about the process. But term limits actually has had an interesting effect on the state of Montana from the standpoint that lobbyists and some say the administrators of different departments actually have more power, because the lobbyists who have been working in and around the legislature for many years and really understand their issues quite well often have the opportunity to sway legislators' opinions one way or another. And sometimes, again, with term limits, legislators don't have the opportunity to really develop a knowledge base where they feel very confident in making decisions or putting together legislative ideas or proposals that they feel very strongly about and have issue expertise on. But legislators, again, the term limits, the institutional memory is really diminished. We have seen some, I guess, interesting phenomenon over the last several years since term limits have come into play. I remember one legislative session where you had second-term legislators in the House who were committee chairs. And so they had only been in the legislature for 90 days that first term 2 years ago, and they were chairing committees. And it was really quite interesting from the standpoint of how those committee hearings actually were run. But I think what we need to pay attention to are the people who are running for office. As I mentioned before, we have several people who served in the Senate that are now House members. Several people from the House have also gone over to the Senate. But I think importantly, you will see people who have served in the legislature, in the Montana legislature, running for other offices. So for instance, if you think about Senator John Tester, Senator Tester used to be a member of the Montana State Senate, and he was actually the Senate pro tem. Or actually he was the Senate president, excuse me. And so he obviously ran for the US Senate and won. If you think about our current Secretary of State, Corey Stapleton, he served in the state Senate as well. So Elsie Arnson, who is the Office of Public Instruction Superintendent, she served in the Montana House and she served in the Montana Senate. So it's really important, I believe, to pay attention to who's running for office, to also look at where people are, what policies they're promoting, so that you have a better understanding and idea of what policies and ideas that they may take with them to other offices that they may wish to run for. So we talked a little bit about legislators being very, the citizen legislative concept. So how do people actually make those public policy decisions once they get elected? And I think all of us understand and recognize that when we go into an opportunity of decision making, we bring our experience with us. We bring our work experience, our personal experiences, perhaps past offices or positions of leadership in a volunteer roles that we've had, and then also if we've had any staff that help us. Influencing those decision makers also will be constituents. We've heard a lot about campaign promises, and sometimes people will vow to their constituents that I won't raise your taxes, or I will, raise taxes on tobacco or whatnot. So sometimes those promises that you make to constituents actually fall into and influence public policy decisions. Financial contributions, I think, are another area to look into in terms of public policy decisions. The one thing that's nice about Montana is that we have very low financial contribution limits, so which is wonderful, because that way there isn't an opportunity for one political action committee or big financial donor to perhaps buy a legislator. So that, I think that's great. Opinion leaders, the media, staff, spouse, all of those are other influencers that really take into or that can factor into public policy decision making. One of the things that I know that we like to do, and other constituency groups or lobbying groups like to do, is try to place really hot, influential letters to the editor or guest opinions to really try to influence public policy decision making on editorial pages throughout the state. The other big public policy decision making influence will be committees and issues that individual legislators have of interest. So sometimes they will, when they're sitting on committees, they'll take into account how the issue before them will impact their constituents. Other times I know that we have asked people from a public health perspective to be a champion on an issue, whether it's immunizations or the sale of unsafe milk. Other times people will want to take more of a high profile on some issues, or they'll kind of glom on to an issue because they, again, have future political ambitions and they really want to be the leader. So I think it's really important when we're wondering how public policy decision makers make decisions, to make sure that we see and understand all of these different factors that go into influencing those decisions. In public health, we like to really talk a lot about evidence-based decision making. Unfortunately, sometimes evidence does not play into the decision-making factors of legislators. And I know oftentimes we wish it would, but again, that's where the politics comes in. So I think we really need to make sure that we be mindful of the politics in making public policy decisions. So now I want to start looking a little bit more at the law's website and show you how to kind of navigate some of this. But first of all, I want to go to the area on the legislative website where you can actually look up who represents you. So we'll go there. And can you see my screen? Jane, can you see if I've got that legislative website up?
It's not up yet.
Okay, let me see if I can new share it.
You got to go to your browser, remember.
Okay, is
There
it
you
up?
go. Yep.
All righty. Okay, so what I did is I clicked on the legislative link in the website, and this is the place from the workflow system where you can actually go in and look up your legislator. So I am going to put in my address and show you what comes up. So I'll find my district, and if I scroll down here, this is where I live in Billings, that purple dot. And if I click on that dot, you'll see that my legislator or my senator is Senator Carrie Smith, and my House member is Representative Dennis Lenz. Carrie Smith and Dennis Lenz are both hyperlinked. So it takes you to a new place on the same website that shows you a picture of Senator Smith, gives you his home address, his telephone number, and how you email him. If you scroll further down, you can see that Senator Smith has served in the House for 3 sessions, and now this is his 3rd session serving in the Senate. And down here, you can actually take a look at what bills he is associated with right now. So right now he has a draft bill in, which has LC, and LC stands for Legislative Council. It's just how the Legislative Council and the bill drafters keep track of all the different requests that they get. And you'll see that this bill to establish the Montana Dyslexia Screening and Intervention Act is in legal review right now. But he's got a bill down here, LC 1494, that is dealing with revising laws to informing on legal opt-out options for vaccines. So I can tell you from a public health perspective, we're paying very careful attention to that bill. So that's really how you can take a look at your different legislators from the legislative lookup. But also, back to our presentation, this legislative automated workflow system, or the laws system, enables you to do many different things from that homepage, and we'll go there in just a few minutes. But just basically, you can look at legislative bill text, you can look at the status of those legislative bills, you can set up a preference account, making sure that you can follow bills around. You can look at committee and floor agendas and hearing schedules, vote totals. You can go back several different legislative sessions and find out lots of information. You can also watch committee hearings online if you're so inclined to do so. Some people think that watching paint dry would be more interesting. Sometimes not. But let me click into the home page of the legislature. And so Jane, do we have the home page up?
Got it, Barb.
Okay, great, thank you. So this is the home page for the Montana Legislative Branch. And there's a lot of different ways that you can navigate this home page, but what's really wonderful about this laws system is that it really does provide citizens an opportunity to participate in the legislative process. So this is the home page, and you can scroll down and you'll see that from the home page you can find your legislator. We were just there a minute ago. We can find a bill. We can send a message to a legislator. We have legislative session information. We've got information on committees and hearings, and we can look at the budget and revenue information. So I think the first thing that, well, I guess I'll scroll down a little bit more so you can see more about what's going on, is you'll see that they have upcoming meetings. So you can take a look, and the way that they've redesigned this is that you have like all the Senate committee meetings, the House committee meetings, joint appropriations subcommittees, and other meetings. So you'll see live right now, and we can't go there because there's no live stream, but there is a committee presiding officer orientation luncheon. And then you'll see that the next opportunity this afternoon, they're to watch or listen. The House will be in session at 1 o'clock, and the Senate will also be in session at 1 o'clock. If you hover and click over these watch listen hyperlinks, you can actually go in and you can watch on your computer and listen on your computer to the proceedings. So that's a helpful place that you can look at there. If you continue to scroll down, you have some more information about the legislature itself. And then you scroll down and you can see kind of more of the web map. You can look at the administrative staff committees for the legislature through the Legislative Services Division, the Legislative Fiscal Division, and the Legislative Audit Division. You can find out more about the legislature, visiting the Capitol. Facts and statistics are really very interesting. And then you can figure out how to, if you have a son, daughter, niece, nephew, grandson, granddaughter, who maybe is interested in being a page at the legislature for a week, this is a wonderful opportunity. You can find out more information about lobbying. And then again, here's the information for legislators about bill drafting and whatnot. But, and you'll see at the top of our screen, here's other ways to go ahead and take a look at things. We've got laws and bills. You can look up your bill information from here. Your legislators, you can also find a legislator from here. Here's your watch and listen button, where it just takes you to the different committees, which you saw from the home screen. And then here's the committee link, and you'll find more information about the different committees. But I think what we'll do is we'll go to the laws and bills section where we can look up some bills. So it takes you here. And what we'll want to do is we want to look up bill information for the 2019 session. So this takes you to a wonderful page where you can find more information. But if we just want to look up bill information, you'll see the way that this is divided. If you know your bill number, HB stands for House Bill, HJ, House Joint Joint, and then House Resolution, Senate Bill, Senate Joint Resolution, and then Senate Resolution. If you know what your numbers are, you can put those in there and find them. Or you can select by legislator. Let's just select the top one, Kim Abbott, and find her. And you'll see that Representative Abbott has introduced, or a total of, or not introduced, but she has requested a total of 10 bills. There's one bill that is introduced that will have a hearing in House Taxation on the 16th of the month at 9 a.m. in room 152. What's nice about the way that this is worked out is that each of these are hyperlinked. So if we click into this bill, we can actually take a look at the bill text. Kim Abbott's name is highlighted, and if we clicked on this, it would take you to her page. It has the status of bill actions. So you'll see that she requested this bill way back at the end of July. And so in November, she got the bill back to review. It needed to go into legal review. And so something that started out as a bill draft request in July actually became real language the middle of December. So it was referred to the House Taxation Committee, and now it's scheduled for a hearing. But if you scroll further down on the screen, you'll see that this bill was actually requested by the Department of Revenue, and it came through the Revenue and Transportation Interim Committee. The drafter was Megan Moore, and again, the primary sponsor is Kim Abbott. And then you can actually find where this bill might show up in terms of how to search, and I'll show you that in just a minute. But you'll see that it deals, you can find it through developmental disabilities, you can find it through the health, state revenue, rulemaking, taxation, and whatnot. But then also down here, you can take a look at additional bill information. So you'll see that there is a fiscal note, which tells you more about the financial implications of the bill that will probably be required. It's a revenue bill, so it has to be House where it's originating, because Kim is a representative, over to the Senate by the 15th of March. And then it has to be returned from the Senate to the House by the 28th of March if there are amendments. So we'll scroll back up here and just go back, and we'll reset this. So you can select by subject. Let's just go to health. So if you're interested in different health bills, you can click on that, and then we can find it. There must be a lot of them because it's waiting. Oh, there we go. There's 123 legislative bills that have to do with the subject of health. Right now, six of them have hearings or will be having hearings, and they have been introduced. And then you can scroll down, and every time there's a PDF that shows up, you can actually click into the PDF. And let's just click into this PDF, and I'll show you what a legislative bill looks like. So this is a legislative bill that's an act revising laws related to youth suicide prevention, establishing evaluation criteria for prevention grants and appropriating funds. This is a relatively short one. It's only 2 pages long. So you can actually take a look at the language and see if this is something that you're interested in following along. This is definitely one on our list that we're watching. But so there's lots of different ways that you can actually take a look at bills. One of the other things I want to show you through the legislative thing is that you can actually establish a preference account. And a preference account is just a listing of legislative bills that you are particularly interested in, and so you can track them. But you can also take a look at all the introduced and unintroduced bills. I think there's close to 3,100 of them right now. Many of them will never actually get language behind them, and they're just more placeholders. But the number of bill drafts that have been requested is a record. But let me just show you this preference account login. I've set up a preference account for Riverstone Health, and you'll see that I've gone ahead and I've categorized my preference account by a number of different headings, if you will. And let's just take a look at the budget and legislative process heading. So what I can do, if I know the number of the bill, I can add it up here, or if I know the LC number, I add it up there, and I just add the draft. Also through here, you can see that here's a bill that would prohibit PowerPoint usage to the legislature, and I've set it up so that when this hearing is going to happen, that I will get an email notifying me of when that hearing is and where it will be. So I've been able to kind of go through and set up kind of the bills that I'm really interested in. So like, here's the General Appropriations Act, how government gets funded. So you can take a look at all different, you know, the different information that's included in some of those bills, and you can sign up to be notified if you would like to receive more information. You can actually also look at advanced maintenance for this. Let's take a look. And this just gives you a different screen. And there we go. So it just gives you a little bit different screen on how to take a look at this stuff. So just however you feel like you want to do it. This gives you a little bit more information, and you see the requester, when the date was requested, what the status of it is, and the short title. And if you want to delete it, or be notified if there's a hearing or not, you can also add some notes in the add note file as well. But I think that there's a lot of great information and opportunities to look at and follow along in the legislative process. It's pretty simple and easy to look at the legislative website, and I do encourage each of you to go out there and spend a little bit of time with it, looking for just becoming familiar with it. But I'll show you another area in terms of committees. If you want to look and see what's going on with committees, let's see. Oh, actually, this is really good for everyone to see. This brings you up a list of which representatives are serving on which committees. So you'll see and when they meet. So the Appropriations Committee meets every day, Monday through Friday, in room 102 at 8 a.m. And you'll see the members of the Appropriations Committee listed there. So if you have members on that committee, definitely go out and take a look at the committee assignments, so that you have an opportunity to see where the people from your area, what kind of committee assignments they received. Let's see. I also want to see if I can find. Here's the committee and hearing schedule information. This is also really important. There's a drop-down box. So if you want to take a look at, for instance, we're really interested in, let's just do House Human Services. You can go just to that committee and you can find that they meet Monday through Friday in room 152 at 3 o'clock. And on the 10th of January at 3 o'clock, they are going to hear 3 bills. And you can click into each of these hyperlinked bills to see what they're all about. But then furthermore, you can also get information about who each of these committee members, they've got their names, but then you can also hyperlink or click on the hyperlink and it takes you back to the legislator detail. So you'll see Kathy Kelker from Billings. She's served in the House since 2015. She has these bills that she's requested. She serves on Human Services and the House Judiciary Committee. And then you can also look and see, these are all the bills that have been scheduled in the committees that she is a member of. So I think what I'll do is I'll stop there and see what kind of questions any of you have in terms of what goes on either during the legislative session or where you might find things on the legislative website.
Barb, this is Jane, and I'm wondering if you'd go back to the Appropriations Committee and click and just show them where the scheduled hearings are. Because that's a pretty important one. That's where your budget comes through from Public Health and Safety Division. And they do keep a calendar there. I don't know what it looks like these days, but.
Yes. So here you would go to the Joint Appropriations Committee on Health and Human Services. And we can get a detailed committee schedule.
There you go.
Here we go. And you'll see here the names of the people who serve on the Health and Human Services Joint Appropriations Subcommittee. And as Jane mentioned, the hearing for the Public Health and Safety Division will be on Tuesday, the 15th, so a week from today, from 8 until noon. So public testimony, what will happen is that Todd, who is the division administrator, will have the opportunity to give an overview of the Public Health and Safety Division. And then we have coordinated testimony between AMFO, MIHA, and MPHA in support of the Public Health and Safety Division. And then you'll see that the next day they're going to have a tour of the lab, and they will be meeting every morning, through, it looks like they're scheduled to wrap up on the 22nd of February. So every morning at 8 o'clock, many people will be taking a deeper dive into the workings of DPHHS.
So I am unmuting all participants now, and I see that Drinda had a question she'd like to pose. Drinda, so if you want to speak, go ahead, anyone, please. And then if you're not speaking, go ahead and mute yourself just to keep the noise down in the background. But Drinda, why don't you go ahead? Or whoever it was. Someone at Lewis and Clark Public Health had a question that they posed on chat. Hello? Well, I'll tell you what it is. It says, okay, can you share your preference list with others? Oh,
yes, you can share preference lists with others. But is it specific that you want my preference list to share with you?
We'll have to wait for Lewis and Clark County. Are you asking, will Barb share her list, or can preference lists be shared? In general, it was just a general question.
Oh, yes. In general, you can share your preference lists. Let's see if I can show you. Yeah, I know that I have shared it before. I'm just not finding exactly where I would do that.
Barb, a couple other things. Is there still a helpline, like a number you can call? There used to be a little bit of support for the system.
Yes, there is. And it is actually right here, questions at the very top, 444-3064.
Great. And I know they used to be really good about helping you kind of click your way through it. I guess the couple things that I would add are just, if you're interested in really tracking legislation, just go in and start clicking around. This is super user friendly, and it is definitely worth paying attention to. But anyway, that's just general comment. Anyone, other comments or questions about sort of the whole policy piece or the legislative process or the system here?
Yeah, Jane, I think while we're waiting, I'm going to click on to message a legislator and show you how to do that. You can send a message through this system to a legislator or to a legislative committee. I got there from the home page of the legislative website. So you'll just be asked to fill in some boxes with some information. You can select a legislator, and there's this drop-down list of whoever you want to select, or you can select an entire committee. Again, another drop-down box of which committee you want to send it to, which is really interesting because it doesn't say like public health, welfare, and safety. You would have to know that that's a Senate committee. So I think, yeah, so it's a little strange. I think they need to tighten that up a little bit. But you can take a look and you can actually type in your House bill number, your Senate bill, if you're for or against it, and then a very short message. And then you just hit send message, and it will go to your legislators who you select.
Okay, I'm not hearing any questions. So just a few comments to close. And Barb, I don't know if you had anything else that you felt needed to be said, and then I will I have a couple thoughts about things.
No, I just, Jane, I just want to thank you for this opportunity. I feel really very, very strongly that more people should participate in the legislative public policy making and be paying attention to what is happening in Helena over the next 90 days.
This is Crystal.
Crystal, did you have a question? I'm sorry.
Sure. Let me look at our calendar. Let's see. Afternoon is pretty open.
Okay, I think she was multitasking. Sorry.
Oh, okay. So Jane, that's really it.
Okay. Well, thanks, Barb. We really appreciate your time and the thought that you put into putting this together. I think it's a real practical, hands-on piece. And as I said, I think that it will all make sense if you just go in and start clicking around a little bit. And just to say too, as Barb said, we are so affected by what happens at the legislature. All of the funding for public health that comes from the feds and the state money comes through this process. Of course, you all are funded as well by your local governments, but it's quite a chunk, and I know it's still a majority of the funding that ends up at the local level. So definitely the funding piece and a lot of the policy that impacts what you do in your communities and what you can and can't do is really important to pay attention to. Having said all of that, I also recognize and feel it would not be right not to say, of course, we realize that you all have your local processes to work through and that you have protocol with your boards of health and commissioners about your legislative involvement. So just want to, make sure that, you all are aware of that and checking in with your local folks about your activities or whatever. So that's really all I had. I wanted to also say I did send out schedule requests for the Community Health Strategist program participants. There are 6 groups, so it is a scheduling challenge to make, to set up meetings for each of the groups that will work for everyone. So I recognize that there will probably be folks who can't participate, but just shoot me an email. I will reschedule if groups look like there are too many people that are going to be missing. But if we're just missing one, we're probably going to have to just keep moving. So look forward to those. And then I am working. We will have a webinar in February, and it will be on collective impact and the use of that model with community-based planning and implementation of programs and services. I think it'll be really helpful. And it fits very nicely, I think, with the community health strategist practices. And then I am also working with the Center for Creative Leadership, and they are the folks who did the boundary spanning workshop. And they're gonna, I think that one of the topics, just based on some of the survey feedback that we got from all of you, is going to be, the next one is going to be on influence. So stay tuned, and I look forward to talking with all of you. So I think that's what we've got for today, and I'll just open it back up. I unmuted all of you. If there's anything else anyone wants to.
Okay, yeah, because it's showing the county as Muscle County. So it looks like he's in there. Yeah.
With that, we'll go ahead and
let me go in and look.
And adjourn.
Yeah,
So
no
thank
kidding.
you so much.
Well, it's saying that he is due for